Good day to you. You're welcome to the program, The Happy Baby Show, here on Radio Global. And I have with me in the studio our guest is a health consultant, and we are going to be talking about today. What are we going to be talking about today? We're going to be talking about the complications, the health issues, health conditions that one may have, or the baby may have or develop when there is a complication during delivery. You know, health complications, health issues that arise during from complications during delivery. So that's what we're going to be talking about today. We had the series, we talked about the different trimester, we went on to preparing for delivery, we went on for delivery itself, and now we're going to be talking about the health issues that can arise when there are complications during childbirth. And we know that we, as much as we may have healthy babies around us here and there, it still doesn't cut out the fact that some people are going through a lot because there was one form of complication or the other. So our health personnel, health person in the studio right now, we're going to be talking about that today. His name is Emmanuel Robinson, and we will be talking about just giving you insight into the things that may happen, and subsequently in other editions we're going to be telling you how to work towards avoiding all of any of these complications at all. So good day, sir. Thank you for coming.
Thank you very much.
All right, so now let us just start out. Okay, I would want us to just start off now with, okay, what is delivery itself?
All right, delivery itself, it's a state at which the mother must have gone through, like you said, the trimesters, the first, the second, and the third trimesters, at the point where she is properly positioned and the baby for quick delivery into the new world, into the earth.
Okay. Where the mother is properly positioned.
Yes, where the baby is ready.
Yes. Yeah, this is usually the 40 weeks span.
Of course,
the 40 weeks, yes. And when it comes before the 40 weeks, it's known to be premature yes. And preterm, probably preterm. Yes. So, and sometimes we also have the overdue.
Of course.
The overdue obviously sometimes are complications on its own.
Exactly.
There are complications on its own. So now let us move down to talking about what is expected in a normal, simple, straightforward, no hassles delivery.
All right. If you permit me, I would like to take it from this point. I love using illustrations.
Okay.
Maybe that will drive the point home.
Okay.
For instance, you bump into a little complications on the highway. Your car did not just leave your garage to get to the highway. You probably did not fasten your seatbelt. Probably did not check some things before you embarked on that journey. Now, I'd like to build it from this point that there are certain things mothers need to look into before the pregnancy state comes in view. I have about 5 of them. If I can state it, the first one is you need to get your thyroid hormone level checked. There's an interplay when there is a state where we call hypothyroidism, where the underactive thyroid, you get it. It's very common among women. Understand? Okay. Now, if in this case the woman's thyroid is having deficiency, it will go a long way to affect her at delivery. Okay, so and how will I put it this way? It's one of the things that affects fertility, though. All right, and if this is not properly checked, it can lead to miscarriage, which will be one of the things that we're going to center on. That's one of the complications during delivery, because it's very disheartening. Like you said a few minutes back, some women are going through a lot of issues right now as we speak.
Yes.
And the essence of coming here is not to put panic into anyone listening right now. It's for you to have an information that keeps you at the edge of getting yourself better on. The next after that is get your vaccinations. It might sound like, Do I really need it? Yes, you need it. Get your vaccinations. It's helped. There are 2 series of it. The one I call the MMR. It's something that has to do with helping you to keep yourself healthy against measles, mumps, and rubella. You understand? Then the other one is the DTP, the diphtheria, tetanus, and pertussis. Okay, and it will really help a lot. Then the third one, which I have to hit on very shortly, is stock up on just some supplements. You will discover, like I said, okay, using the illustration of a car, all of a sudden you discover your car starts to jack. If you had paid close attention, you probably wouldn't have gotten into that mess at that point. So a lot of us, you'll be shocked to hear that some people don't have enough vitamin B12. It has an interplay in helping so that you will not have later complications while delivering. Then vitamin B6 and omega-3, all of these essential vitamins. Then folic acid, yes, it has been discovered that it takes time for the body to really build this up in our system. And also maintain regular healthy exercise.
Yes,
it is very key, not necessarily being a rigorous exercise as the case may be. So the last but not the least is don't get yourself stressed or don't get fret. All right, going to this topical issue about complications that may arise. We have Preeclampsia. That is the situation whereby the blood pressure of the mother-to-be is accompanied by protein in the urine.
Okay.
All right. And for you to be able to know this, that is why you have to keep a good relationship with your physician. The physician helps you to know all of that. The preeclampsia can cause the placenta to detach. All right. And if the placenta is detached and the baby to be born comes too early, it increases the risk that the baby will have problems soon after birth. It's very disheartening to hear that. Then at times some symptoms that you might see, the woman's hands and feet may swell. You can have cases where she will have severe pains at times, and if you have seizure, it's medically known as eclampsia. If there is seizure over and over, it can lead to death. But this is not to scare anyone actually. But what we are really interested in is to empower people to know what you need to do to help you to enjoy ultimate health while delivery. All right. Okay. I want every listener to know that we have what we call the HELP syndrome. HELLP. All right. HELP syndrome. From the letter H, I would like to talk about the hemolysis. That's the breaking down of the red blood cells. Okay. I don't know whether you've had a situation whereby a pregnant woman will say she feels like she's not having enough red blood. Oh, good. So you need to go for constant checkup. Are we together? All right, this helps us. Then the E there talks about the elevated level of liver enzymes.
Okay.
Good. All right. So, and that's it indicates liver damage. But please, I would like to say this over and over again because of the sensitivity of this topic. Okay. If you're listening wherever you are, don't be scared. It's good you talk to your physician. Okay. So now then we have what we call the low platelet count. That is when the red blood cells get this is not clotting, making blood less able to clot.
Okay.
Get it increases the risk factor. There's the risk of bleeding during and after labor, which we know might sound so. That is one of those things that we need to look at. Now, some of the causes you will be interested to know. The causes of preeclampsia is unknown, but it is more common amongst women. For instance, a pregnant woman, someone who is just having the first pregnancy, there is often that tendency to come in that bracket to have preeclampsia. If you just carry the first baby for the first time, then someone who is carrying 2 or more fetuses, someone who we know at the time of delivery we should be expecting more than a baby, so they often have these symptoms too. the signs too. Then they have some of them are obese.
Okay.
A lady, a pregnant mother that is excessively obese, it has an interplay. That is why before one gets pregnant, one of the things I like to talk about is you need to know your BMI, your body mass index.
Yes.
For every height, there is a particular weight you need to attain.
Okay.
If you exceed that way too far, one is termed as obese. Okay, so it also helps. Then also oftentimes we've had pregnant women, they said they have high blood pressure. There's some triggers, their blood pressure triggers above the 120/80, the systolic, diastolic reading. So, and their pulse, fine, it could be the state at which they are. You don't just knock it out. Then having blood clotting disorder is also another thing. Then for some women that are pregnant, that they are younger than 17 years or older than 35, there is more tendency for them to have this preeclampsia, as the case may be. So some women that have some women actually don't have symptoms. In other cases, the fluids accumulate, and when the fluids accumulate, like we know, it is called edema. When the fluids accumulate, particularly in the hands and on the face, you can literally know there's kind of swell, excessive swelling, but I would still urge that the woman should listen more to the physician. That is why you don't keep a long contact from your physician. Personal recommendation should be avoided. In fact, at the moment a woman notices that she's pregnant, there's this particular special care that she deserves. So the state of her health should not just be played with like a guesswork, so, as the case may be. Okay.
So now let's just move on to the fine. We've talked about the complications that can arise.
Okay.
And now let's just talk about the health conditions that can come from it. We can have the placenta coming before the baby, and that would also cause something. We have different ailments. I would want want you to list all of that, and some of them we might actually have them coming up with autism, coming up with the Down syndrome, and most of these things, they are caused by you doing delivery. We have shortage of oxygen going to the brain. I do not want to start talking going to all of that. So I just want you to just list out all the things, the ones that can happen to the baby, the one that can happen to the mother, when there are problems during delivery or childbirth.
All right, one of the things I would like to talk about, like you said, I want us to understand the term labor and delivery, as the complications may be the preterm labor or the premature delivery, as the case may be. If it happens, if the labor contractions occurs before 37 weeks, get it, it is called preterm labor. Now to the baby, because here we're talking about two personalities, the mother and the baby. All right. Now to the mother, most often we have had issues where some women they have constant dizziness. You get it at times. Okay, look at this. There's what we call the gestational diabetes, as it affects the mother. You get, and the baby eventually. Now, gestational diabetes, it's a form of diabetes that is diagnosed during pregnancy. You get it. All right, it is not the type 1, type 2 diabetes. No. Good. All right, good. Now, being diagnosed with gestational diabetes means that there are additional concerns to be addressed during the woman's pregnancy, and the higher risk for making the woman to be diabetic later. Okay. Good. Like all the types of diabetes, gestational diabetes is caused by an inability for a woman's body to make enough insulin. Okay. There's an interplay with insulin, that is why. Now, for most women, gestational diabetes doesn't cause any noticeable symptoms. While most women with gestational diabetes give birth to healthy babies, the condition can increase the risk of that baby later in life. other health risk factors could include jaundice.
Okay.
Yes. So before we could say a baby has jaundice, there must have been an interplay with the state of the growth of the baby with the mother affecting the baby. The baby now comes like the end result in such cases. Then respiratory disorder syndromes. At times, some of them might have abnormal low level of minerals in their body. You get it? It goes way back. Talking with a lot of concern how it affects the baby by the time they are being born. And at times, the lifestyle of the woman, fine, you might not be able to checkmate the lifestyle of some women, so to say. From our own experience, we discovered that, do you know that some pregnant women, they smoke? They drink.
Yes,
they do some things that eventually will have an interplay in affecting the brain of the baby. Are we together? So now some complications that I would like to really hit on, just maybe in few minutes, is just the placental abruption. Okay, now placental abruption occurs when the placenta completely or partially separates from the uterus before the baby is born. So most complications, as the case may be, it is not during the few times that the woman is in labor. It must have degenerated over time while the baby is still in the uterus. Okay, so that helps us to understand that. So more babies, it affects many more babies, though, you know, having issues with the umbilical cords around them. Then you have some babies, later complication is slow growth, you know, retarded growth, you know, vomiting, dizziness, you know, and all of that. Okay. So, and at times, it's not all the time. Maybe 1 in 10 women could come up with low birth weight, where the baby. It's also an issue that we should not just throw off the carpets. You know, that needs to be looked into. Okay.
All right, and so now we've talked about that one. So what about the various health problems that the child can go through, or the ones that people can say, oh, okay, this child has this, and you know, for the lay woman out there who is just listening, who might not understand all the scientific names and all of those things, she might just get like, I give birth to my child, but the child is not talking, the child is not this, or the child is not the body is still stiff, or the baby body still stuff. You know, people just come up with lots of things, and they say because of how the nurse handled the baby, because of what happened during this thing, because she stayed stayed for labor longer than normal. No, we just want to quickly list those things out right now.
I would rightly say that from the moment the woman starts her antenatal birth, she needs to, whatever, no matter the drugs given to you in the hospital, please, you have to use it. Self-medication should not be encouraged. Understand? Because then they need to watch some of the things they eat.
All right.
Get it? It has an interplay in helping mothers, so that the woman, the baby, will not have issues later in life. If you permit me to say, some of all this is, like they said, too much of a good thing can be harmful to our body. Yes. Now, vitamin A, there is a regulated dosage that they should take. Yes. Caffeine, some people cannot just walk past and have the smell they just want to have it. You need to cut down on stuff like that. You know, it will not really help in a long way. Then alcohol, of course, you know, it's an abuse on the woman's health and the baby that will be coming. You know, someone should not say, after all, it's just, no, you need to consider your life and the life of that baby. Many nursing mothers do not realize that they must continue to avoid alcohol even while breastfeeding. Yes, because since the alcohol can also reach the baby via the breast milk and all that. So and just undercooked meat and poultry. you will be surprised to hear that so many women cannot walk past the suya joint. They just want to have the taste of that suya. I mean, a lot of things go on. Okay, let you understand this. Undercooked seafood and rare undercooked meats like beef and poultry can be contaminated with bacteria. You get it? And delicious meats can be contaminated with listeria. You get it? All this form of bacteria will trigger a miscarriage. That is where we are heading to.
Okay.
You understand? So they should cut down on eating undercooked meat and poultry, then fish. And you will now ask me, what type of fish do you expect them to eat? Well, there are two great low mercury fish choices. They are salmon and sardines. Those are the best.
Alright.
Get consuming fish with higher levels of mercury can be linked to serious developmental delays and brain damage in babies, just like you rightly said. So if they say my baby is not responding well, it looks like she's not growing fast or he is not taking time to crawl, you know. At times it could be that during the time of her pregnancy she had abused a lot of things. Then taking raw eggs also is very not bad. It's not advisable. Then soft cheese, you know, some women, they cannot do without sushi, you know, what have you. They just want to have a taste of everything. I don't know whether you've had pregnant women, they say you just feel like eating everything.
Yes, so
at about that time the cravings, you need to walk down. Then unwashed vegetables and fruits. We don't have enough time to go into details.
Just have to wrap up
now to wrap up. If you permit me, there are a few things I listed that we should not say to a pregnant woman. Wow, it sounds very interesting. Number one, are you sure you're not having twins? Yes, we don't need to say such words, because commenting on anyone's size is a major no-no. You get it? Just because a woman is pregnant does not mean it's okay for you to remark on her body. I think it's a sign of respect. Alright, so you don't just comment. And then you're going to breastfeed or bottle feed, right? I mean, it's not a good question. Keep that, it's in that woman's opinion to know which style she's going to use. I don't know whether you understand what I'm trying to say. Then another one could go this way. You really shouldn't be eating that or drinking that or doing that. Alright, it is not advisable you say such. Ultimately, what a pregnant woman decides to eat, drink or do is between her and her physician. You have different body chemistry, you know, the way our body responds different, so you get all of that. Then some other women could say, I did XYZ in my pregnancy and I think you should do it. No. Any pregnant woman listening right now, you may have given birth without the assistance of epidural, you get it, without any assistance while the child is coming. You may have walked out every day for 30 minutes, you know, have done your exercises, but it is in the choice of the health physician to now know what the woman should do. Alright, sorry, I think I have a little lot more. Make sure you sleep or go out and enjoy life. Some people think when you're pregnant, life should be boring. No. Understand? Now, some people say it's too bad for you to go back to work right away. It's just one of all those things. It's a personal choice. You know, then some people will just comment on your stretch marks. They say, oh, that's bone, stretch marks, you know, swollen legs, hair loss, you know, excess weight gain. No, we shouldn't say that. Never comment on anyone's personal body woefully. Because the way I'm going is this: there's a psychological interplay. It makes the woman feel miserable and somehow trigger her blood pressure, that concern, that worry. That, oh, does it mean that I can't associate with my fellow women again? No. I mean, you need to say a lot of positive things to them. I give a lot of respect to all women listening, because it takes a whole lot of grace, if you permit me to say this. We have seen even people who don't have challenges, who go through all the normal necessary things expected from their physician, they still have complications eventually. Alright, so I think it's really been a good time coming around to share.
Alright then. So we run out of time. We just have to quickly wrap up the show. And we have been talking with Emmanuel Rubenson. He is a a health consultant, and we have been talking about the complications and problems that may, health issues that may arise due to complications during pregnancy, during delivery rather. And he has made one fact really clear, that complications do not just come up, you know, at that time of delivery.
Exactly.
You know, health conditions do not just arise or descend on the child at that point or on the baby. It's something that would have happened with time. It must have been piling up. It's something that every mother should watch out for. You know, from the very moment preparing for delivery starts from the very moment of conception. You know, when you discover you're pregnant, going for your antenatals and all of that, you have to be mindful of what you do, your lifestyle, your eating habits, you know, resting, your blood pressure, you know, your intake of food. They must be clean, your hygiene, everything, because it boils down to the baby. It boils down to what's going to happen even during delivery. There might be complications if you have like even the mother can also have some, like what I said about the blood clotting and all of that, the HELLP syndrome, the HELLP, the HELLP syndrome, you know, all of that can also come up. But these are things that can be averted during the 9 months, during the 40 weeks of pregnancy. It is something that you have to watch every single day. You have to put things in place, you know, every moment you have to be mindful of things, because it goes a long way to affect delivery. It's just not okay, should we to carry it? I'm doing enough already by carrying the baby, so what's the stress of you telling me I should do this, I should do that? You get, some people actually act like that. But for the safety of yourself and of that of the baby, you have to watch everything you do, what you eat and what you do, and your lifestyle and all of that, so that you can have a safe delivery and less tendency for complications. Because once you're preparing with your physician, preparing with your doctor, and with the gynae and the obstetrician, you'll be able to know, okay, what you're supposed to do, what would happen, what will happen, so you can prepare for it and have it. Okay, so with that, we have to wrap up the show for today. Thank you so much for being a part of the program. Thank you so much for listening. Do make it a date with us, and we'll be coming back with another wonderful topic, and we'll be talking about on the Happy Baby Show. So do not miss it. Okay, I am Amy, and once more I want to say thank you to Emmanuel Robinson for coming today.
Thank you,
all right then, so with that, we call it a wrap, and do stay tuned to Radio Global.